If you find this video useful, leave a comment, save it and share it. Let's see how the ice application became so famous. In 1978, an orthopedic surgeon, Dr Gabe Mirkin, came up with a familiar acronym RICE, which stands for Rest, Ice, Compression and Elevation regarding how to address inflammation. This method has been used as the gold standard for over 40 years for addressing acute injuries. 40 years later, Mr. Gary Reinl cited numerous studies which prove that rest and ice actually have a negative effect on healing process, and 2 years later, the founder of RICE method recanted its original position. The acronym that Gary Reinl came up with is ARITA, which means active recovery is the answer. Therefore, mobilizing without pain the injured area will actually speed up the recovery process. Now, regardless of type of injury, the same physiological events occur. The body responds to 4 overlapping phases in order to heal. We have the bleeding phase, the inflammation phase, the repair or proliferative phase, and the remodeling phase. When muscles and other tissues are damaged, your immunity sends the same inflammatory cells to the damaged tissue to promote healing. It is important to understand that we cannot have tissue repair or remodeling without inflammation. The inflammatory cells, called macrophages, release a hormone which is called insulin-like growth factor or IGF-1 into the damaged tissues, which help muscles and other injured parts to heal. So inflammation is a necessary component of the healing process. Also, ice does not help with excessive fluid. The lymphatic system removes swelling from the damaged area. The lymphatic drainage is facilitated by contraction of surrounding muscles that pushes the fluid back to the cardiovascular system. Therefore, applying ice to reduce swelling actually delays healing by preventing the body from releasing IGF-1. Also, when ice applied to damaged tissues, it creates local vasoconstriction, which is the narrowing of blood vessels. Because of this, we have reduced blood flow to the area and less hemoglobin protein, which is responsible for delivery of oxygen to the area. Instead of ice, what you actually can do is, if possible, elevate the injured part to use gravity to minimize swelling. And secondly, you can do tissue loading. Tissue loading or other mechanical means stimulates formation of type 1 collagen fibers. On the first comment, you will find what Dr. Gabe Mirkin said about ice.